Hi, I'm Schroeder, registered dietitian here at Tucson Weight Loss Surgery, and today I'm going to talk to you about some mindful eating tips and strategies, because how you eat is just as important as what you eat. So we need to make sure that you are really in tune with your body and using these mindful eating strategies to make sure you are getting the most out of your surgery and the most results that you can get. So we want to make sure you are using all of your senses to enjoy your meal. You want to smell it, you want to look at it, you want to taste it, you want to feel the texture. Let your senses overtake the whole experience and make sure that you are free from distractions as well. Most of us, and I'm guilty of this sometimes too, eat with distractions, whether it's in front of the television, looking at your phone, on the computer. There are plenty of distractions that can take away from the experience of mealtime. And the reason why we want to be free of distraction is for a couple different reasons. Number one, it allows you to use all of your senses to completely focus on your meal. And number two, it allows you to really tune into those satiety cues that we want to be as focused on as possible. So if we are eating with distraction, it is likely that we don't even realize that we are full when we are just focusing on finishing everything on our plate. But if we remove the distraction and really focus on ourselves and our body and how our body's feeling during the meal, we can stop when we're actually hungry. Stop when we're actually full versus eating mindlessly and feeling overly full by the end of the meal. So here are some really great post-surgery mindful eating tips that you can even try right now to get you into the habit of eating mindfully before you even have your surgery. So number one is you want to cut all of your food up into teeny tiny pieces, like the size of a pea or a bean or an eraser. You can do this before you even start eating, so you can cut everything up once and not have to worry about it again. So after you have all of your food cut up into its little tiny pieces, we also want to make sure that you are using a small plate. Because you will be eating smaller portions after surgery, we want to make sure that your plate reflects that. Our very first sense that we experience a meal with is our eyesight, right? So if you take a look at this plate here on the screen, that same portion of food on a large plate signals to our brain, hey, this isn't going to be enough food for me. However, if you see an already full plate going into the meal, same exact portion, but just on a smaller plate, your body, your eyes are signaling to your brain, oh, okay, this is a full plate, I'm good to go. And you're less likely to overdo it. But if you started off with that big plate and you ate the exact same amount, it's likely that you feel like you want to eat more, even though you don't really need it. So in order to make eating these little tiny pieces of food easier, try using smaller utensils. So whether you use a child size or a baby fork, or get some cocktail forks, that way those little small bites don't look so teeny tiny on a large dinner fork. So get some smaller utensils, and this will help the whole process be much more easy. So we also want to slow down. This is something a lot of people are also guilty of, eating too fast, and it is very common. So if you do this, don't feel bad about it. Just know we want to be mindful of how fast we are eating. So every time you take a bite, I want you to put the fork down. You can put your hands in your laps, and I want you to just truly enjoy that bite Chew very thoroughly, maybe about 25 to 30 bites, or until that bite is the consistency of applesauce in your mouth, okay? You can also set a timer. You can use one of these little sand timers or on your phone, though if we are eating without distraction, hopefully your phone is not right next to you. And you want to wait 1 minute between your between your bites. Pardon me. That way you are able to really hone into how your body feels after each bite. And this also helps you slow way down while eating, which is a huge part of mindful eating. Also know that your fullness is going to feel different in your body after surgery. So what you feel as full or stuffed right now is going to feel different after you've had your surgery and your anatomy is reconstructed. You might be experiencing back pain or shoulder pain as a sign of fullness. You might have some sneezing. You might have hiccuping or excessive salivation. So I want you to take note of these new full feelings and recognize them during your meal. And once you start feeling full, it's time to stop. So let's review how you are going to eat mindfully. Without distraction, you are going to cut up all of your bites into little tiny bites. You are going to take one bite, put your fork down, chew thoroughly, wait 1 minute, and repeat this process until you feel full. And that might be before the food is all finished off your plate, and that's okay. You can save it and have it later. You do not need to be a member of the Clean Plate Club anymore. Okay, I hope this was helpful. Go practice your mindful eating habits right now. Do it your next meal, and I hope this was helpful. See you in the next one.